Welcome. Thank you for spending your time with me today. My name is Gregory Schwaid. I'm a physician based in Tampa, Florida. I have 10 years of experience practicing urgent care medicine and currently serve as the medical director for one medical center in Clearwater, Florida. I've been asked to go ahead and give a brief overview of the intersection between urgent care medicine and tourism. Well, why is this important, you may ask? Well, number one, it provides a very valuable service to the community. But from the urgent care perspective, it provides a valuable way to diversify our income and services. For example, in Tampa, Florida, as well as the North American region, we experience seasonal secular changes in urgent care volume. This is typically revolving around the seasonal upper respiratory infections that we see more often in the winter months. Well, in the summer months, we don't have that volume to depend on, so we like to look elsewhere. One great place to look is tourism. Now, tourism goes two ways. Number one, you have the tourists that are leaving your region. Number two, you have the tourists that are coming to your region. Urgent care can fill needs for both sides. For the tourists that are leaving the region, it's very important to note that we can offer immunization and travel needs. For example, let's say that somebody's going to a region where yellow fever is endemic. Well, these patients rather, may need what's called a yellow card, where they receive vaccination for certain diseases. Well, urgent care can fill that need and provide that service. Other common endemic diseases include malaria, for example, and these are things that urgent care companies can offer. Now, sometimes these preventive treatments may be very expensive and maybe not worthwhile for an urgent care company to hold on to. However, it is important to note regional travel clinics in the area where you can send your patients for important inoculations. But for the other ones, the less expensive inoculations, that's something that we can provide at urgent care centers. For example, if somebody's traveling to a region that has endemic malaria, where the local malaria is susceptible to doxycycline, well, that is a service that I can and often do offer to our patients that are traveling abroad. Now, on the other end, we offer services to patients that are arriving to our area. Being in Clearwater, Florida, we are a tourist destination for people around the world. The number one tourist that we do see is as people from the United States. However, we do also see a large amount of people coming abroad from Canada. It is very, very important to note who is coming to your region, and that can help you cater to these people individually. Now, it is impossible to have the ability to treat everybody from every country. However, it is important to have a plan in place when you do have patients coming from other countries. Uh, special billing packages should be available for tourists. Uh, there should also be strategies in place to accept currencies from other regions, maybe digital currencies or cryptocurrencies, as well as regular uh, currency backed by the foreign governments. Many countries also will have unique healthcare models for their traveling citizens. It is not unusual for the patients to come into your clinic with forms for you to fill out so they can get reimbursed by their home country. Now, while providing services to these patients that come from other countries, it is important to also note that these patients also have varied needs. Now, these needs may be cultural, they may be something that you see more often that's coming into your clinic from the local area. For example, in Clearwater, Florida, we'll see a lot of sea anemone or jellyfish stings, and that's something that you may not see elsewhere. However, it is important to note not only your local trends, but also local trends going on from other areas abroad. People may be traveling for religious purposes, they may be traveling for a business conference, or recreational purposes as well. Whilst treating these patients, it is very important to ask why they are traveling. Another important competency for urgent care clinicians treating tourists is cultural competency. Now, treating tourists from around the country, rather, around the world, you will see people from all different backgrounds, all different ethnicities, all different cultural uh, significance and backgrounds. And it's very important to have some respect and understand what you can about them. For example, uh, In the United States, we are trained to be courteous and cautious of women wearing hijabs. That may be more common in other parts of the world, but that is an example of something that is not as common in the United States, but is important for you to have some cultural competency and understand. Additionally, you need to be on lookout for other people that are traveling for more nefarious reasons. Unfortunately, in Florida, we have a lot of sex trafficking. We are the state that leads the rest of the United States in sex trafficking. And as urgent care clinicians, we do have an obligation to identify and report these people to protect our patients. Additionally, unique challenges come from tourism in the form of dispensing medications. A lot of these patients are coming from regions or a lot of these patients rather, are coming from areas and they do not have access to car. They do not have access to the local transportation systems. They may not even know where to go. So it is important to be able to plug in these patients and find ways for them to have medications that are necessary. Most urgent care centers will dispense these. If you are unable to dispense these medications, maybe it's wise to have maps to the local pharmacies or maps to local hospitals, or even ways for the patients to be able to access these. Now, that's all I have for today in my very brief discussion. I really appreciate your time. Thank you and enjoy the rest of your conference.